I remember waking up from the surgery in ICU and suddenly being able to hear out of my right ear. For years, I was essentially deaf in that ear at times. It was intermittent. There were times where I had a little bit of clarity, and there were other times where I had no clarity at all. You know, my husband often complained that whenever we watched television that I had to turn the volume up very loudly because I just couldn't hear. In 2018, I was feeling awful. I started having migraines. I was dizzy every day. I just did not feel well. I went to my general practitioner and I shared my symptoms with her. I said, you know, what's going on? I'm hardly able to get out of bed. You know, there was one instance where I had gone to walk my dog and I woke up on the street with no recollection of passing out. She sent me to an MRI, and immediately she sent me an email slightly thereafter explaining to me that I had pressure on my brain, and that was so scary. I went to the emergency room. I spoke to multiple neurologists and they weren't able to pinpoint anything. And honestly, I just kind of gave up on feeling better.
It's important, so we just excuse me.
Okay, bye.
In 2021, I discovered the Cleveland Clinic and Dr. Rahat in the executive health program.
We did all the relevant investigations and I did my appropriate referrals to a gynecologist and did the appropriate investigations for blood pressure.
The symptoms had come back and they had come back worse than ever. The migraines had returned, the vertigo had returned, I was feeling nauseous. There were days that I just wasn't able to get out of bed because I felt so terrible.
Brandi.
So in essence, she was having multiple symptoms. So she was having headaches, blurry vision, difficulty with vision, sounds in the ear, along with other symptoms of dizziness and sometimes cognitive issues such as brain fogging.
So we talked about how she would like to take these steps, and gradually I was able to start her on the appropriate medications and get her blood pressure readings under control.
She again referred me for an MRI, and you know, they found some findings in terms of an empty cella syndrome, which I wasn't familiar with at all, and this still pressure that was on my brain.
She eventually reached Cleveland Clinic, Abu Dhabi, first through the internal medicine clinic and subsequently was referred to the Neurological Institute, where a closer examination of her symptoms raised suspicion of a condition called idiopathic intracranial hypertension. This is basically a condition where the pressure in the brain is elevated and can cause symptoms such as headaches, blurred vision, and tinnitus, which is basically sounds in the ear.
From there, I took so many tests. I went to an ENT, I went to a neurologist. You know, every test that could be done, I did to try to get to the bottom of what was making me feel so horrible. And I wanted so desperately just to be able to return to day-to-day life, you know, to work, to playing golf, to exercise.
But now we know that some of these patients, they end up with vision loss. That's why it's crucial to make the diagnosis and to treat these patients as soon as possible. So come closer and put your chin in the way. So, Brandi, when I look at your optic nerves, and again, this is the eye, and this cable that comes from the back of your eye is called the optic nerve. And when I look with my lens, I see that your optic nerve is swollen. So what we did today is we took some images to the back of your eye, okay? And these are the images. You see this one on your right side. This is your optic nerve, and you can see it is thickened, it's swollen. And when this happens, we start to think about the increased pressure in your brain.
So Brandi was not able to tolerate the doses of Diamox, and she was very clear that she did not want long-term treatments with this medication.
Then I met with Dr. Sebi, and he had a resolution for me, one that I had been searching for years. He recommended that I do a stent in my brain to relieve the pressure. So I asked them, what does this mean? How invasive is this procedure? And luckily, it wasn't very invasive at all.
Idiopathic intracranial hypertension, which was not being treated by medications or which was resistant to medications, were treated by surgical procedures.
And it just so happened that he had an opening for the following Wednesday to perform the surgery. And I didn't think twice about it. I thought, you know, what do I have to lose? I can't possibly feel any worse than I was already feeling. So I jumped at the opportunity to do it.
So I met with Brandi and discussed a whole situation of idiopathic intracranial hypertension, and the images that were performed already showed that one of the veins, specifically on the right side, it's called the transverse sinus, was very, very narrow. I proposed a plan of doing neurointerventional diagnostics and treatments to see if she would be eligible for a particular procedure called venous sinus stenting.
Brandi. Hey, Brandi. Brandi. Hey. Are you okay? Hey, Brandi. Look at me. Look at me. Hey, and then urgent help here in room 212. My patient just collapsed, and she's still weak. I don't have any pulse with her. Would you mind helping me out, please? Hey, Brandi, come on. Look at me. Hey.
Specifically, it is a procedure where we put a tube in the brain in order to drain the fluid out of the brain and divert it to the rest of the body. So procedures like ventriculoperitoneal shunt, a VP shunt. While this is effective, oftentimes VP shunting has its set of complications, most commonly malfunction of the tube and its drainage, and oftentimes infection. So this makes it less desirable in the long term. So we went ahead through our neurointerventional procedure, which is basically a minimally invasive procedure. We go into the vein, and then we take our tubes all the way up to the neck, and then we are able to place the stent successfully across the narrowing.
The surgery went exceptionally well. I woke up feeling like a new person. I was able to hear out of my right ear, whereas before I had extreme tinnitus in this ear. It was a constant ringing that never went away.
This was something that she was suffering for almost 5 years, and as soon as she woke up from surgery, she reported that she could not hear that sound anymore.
Waking up and now being able to hear everything was almost overwhelming to me, because for years I had spent essentially being muted on the right side and not being able to hear people clearly.
After the surgery, she told me that she feels extremely well, and she was glad that she took that decision in going ahead with the surgery. She was skeptical about the surgery, but I think because of that relationship and the trust she had developed with myself, I was able to advise her the right treatment path, and I'm hoping that helped us in coming to the right decision.
I was able to process information a little bit better. There seemed to have been a delay prior to the surgery, and there was this instant kind of renewed freshness that I felt after I had it done.
And many of her other symptoms also improved, such as the cognitive feeling of brain fog or fullness in the head, the dizziness. All these also improved after the venous sinus stenting. So overall, she did very, very well with the procedure, and we were very, very happy with her outcome after the surgery. And she has been able now to come off all her medications which were previously given for the IIH, and right now she is very, very happy with her outcome, with significant improvement in her quality of life.
Now suddenly I had all of this clarity. I'm so thankful for the doctors at the Cleveland Clinic, Dr. Rahat, Dr. Anu, and Dr. Sebi for this interventional medicine that they were able to help me with. I feel better, and that is all I ever asked for.
So I'm very happy that we were able to help Brandi in managing her condition, reverse her symptoms, and getting her back to her normal life.
Overall, I'm very happy that I was able to be a part of Brandi's treatment. We are honored, and it's a privilege that Brandi entrusted us to take care of her with our multidisciplinary clinic. I wish Brandi all the very best, and I hope that she will live her life to the fullest and not be bothered by these symptoms again. And again, I wish her the very, very best.
I would like to wish Brandi all my best wishes. I know I follow her regularly in my clinic, and we have a great rapport, but I think she's come a long way from when I met her initially in 2021, and she is in an extremely better place now. So I hope we continue with the progresses we have made with her health, and I wish her all the best.